I'm here with Christina Shamrock. She's our amazing physician assistant. Not only is she an integral part of all of our surgeries, but she also does some non-surgical treatments, which includes Sculptra injections. Today, she'll be telling us more about Sculptra. So Christina, what is Sculptra?
Sculptra is a polyl-lactic acid derivative that acts as a biostimulant for the skin and improves skin texture and contour over time. And it's approved for most areas of the face except for the under eyes and forehead.
So people are really familiar with HA filler, hyaluronic acid-based fillers, but how is Sculptra the same or different from HA?
So the hyaluronic acid fillers work by adding it directly to the tissue, and they provide sort of the instant gratification, and over time they only add hydration. Sculptra is the PLLA microparticles in Sculptra get absorbed over time, and then they stimulate your own tissues to produce the collagen. So the result is a little more natural and is built over time. The other important distinction between the Sculptra and HA fillers is that all HA fillers are dissolvable, so we can reverse the effect with the hyaluronidase, versus Sculptra is non-reversible.
Christina, take me through the treatment process when the patient first comes to the office and all the way out to, their recovery from the treatment.
So it all starts with a consultation. During consultation, we'll determine whether or not you're a good candidate. We also will determine your goals as well as a timeline of achieving them. Then you come into the office, expect to spend about an hour at our office. I like to start with photos, then I will clean the area. I like to use a numbing cream to increase the patient comfort, and then I will inject the Sculptra either with a needle or a cannula. And then after the process is done, I like to massage the patient's face to distribute the product evenly. And that's also a very important part of the treatment, because I will teach the patients how they will be massaging the area for the next 5 days. With my massage, I include the arnica cream. The treatment itself is fairly comfortable because I like to use lidocaine in my Sculptra. So after I do the first injection, the area goes fairly numb. So overall, the treatment is comfortable.
What about, is there something that patients should do before they come into the office to properly prepare their skin, or to just, for optimal results? There's something that they should do in advance, like reduce bleeding, anything like that?
I like for my patients to not have a coffee at least a day off. A, because the caffeine decreases your pain threshold, and B, also caffeine promotes bleeding. So it may promote further bruising after the injections. Other than that, some people like to wear makeup before the treatment, which I don't quite understand. We'll take your makeup off here, but if you could avoid applying the makeup the day of the treatment, that would also help us.
So then after the injections and after they're done in the office, what are some things that they should watch out for or do afterwards to optimize their outcomes?
So right after the injection, just because of the volume of the fluid that we inject, the area may seem a little bit swollen. That swelling goes away within the next couple of days. There could be some minor bruising, usually presents itself as just yellow over the next couple of days. Arnica is very helpful with that. The non-steroidal anti-inflammatories are helpful. And then I like to do a follow-up in between a week and 2 weeks, just to make sure that we are moving in the right direction. One caveat about the Sculptra is that it needs to be massaged for the next 5 days. So we like to say 5 times a day for 5 days. That's the rule for the massaging. That becomes very important to A, evenly distribute the product, B, is to prevent any lump formation. So the patients who adhere to the massaging, they actually have a really good result.
And then in terms of tracking the outcomes and the results, do you take pictures, let's say before you start the treatments, and then a certain number of treatments after? When do you track, their outcomes with photos?
Yeah, absolutely. I always take the before photos for every treatment, and Sculptra is not an exception. And then every time the patients would come, I would take the same photos with the same camera and the same lighting, and that will help us track the progress. Now, I don't really have my hopes too high for just the first treatment to see dramatic results for the treatment number 2, but depending on the skin condition and patient age, we may already see the effects right before the second treatment. So the photos are really fun to look at. I like to take photos.
So what's the best age to get started on Sculptra?
It really depends on when someone starts exhibiting the facial volume loss. I would say most of my patients are in their late 20s, early 30s.
Can someone who's, let's say, in their 40s or 50s or even a bit older also get started on Sculptra, or is that too late?
No, there's no such thing as too late. It's recommended for anyone by Galderma from ages like 18 to 75. For the more mature skin types, we would need probably a couple of more treatments to achieve the same result as we would for someone who's in their early 30s.
And in general, how many treatments are needed to see great results?
So the studies that have been done on a product showed that doing 3 treatments within the course of several months, so on average 3 treatments within like plus minus 3 months, will achieve the result that could be sustained for 2 years. Now, with that said, my patient who's 27 may benefit even from and see the result even from just 1 treatment, and my patient who's 67 will likely need several more treatments to see the result.
A lot of patients, whether it's surgery or non-surgical types of treatments, they're concerned about downtime. So is this something that you just like run in during your lunch break and get, or does it require more downtime than that?
It really depends on what your job is. I would say it's totally fine to get it on the lunch break. The one thing to keep in mind is that the face is likely to be a little bit swollen for the next couple of days. Then there could be some minor bruising, which could be covered by makeup. Usually we say within a couple of hours after the treatment, you can start using makeup. But the minor swelling, for some people, it doesn't bother them at all. But some people, like for example, if you're a model, might not be a best time for the photo shoot immediately after your Sculptra treatment. I would say wait a week.
Would you say that Sculptra is generally safe, and what are the most common side effects?
It's just as safe as any other injectables for the face, so obviously choosing the right provider is going to be very important. But the potential side effects, even though rare, they could include swelling, bruising, skin discoloration, sometimes there's itchiness. All of these things are manageable through over-the-counter non-steroidal anti-inflammatories. And since we're talking about the potential side effects, I think it's important to mention 2 absolute contraindications to Sculptra treatment, and that is someone who has a history of keloid formation or hypertrophic scarring, as well as history of anaphylaxis or severe allergic reactions to any sort of chemical compounds in the past.
And then with HA filler, we know that we have Hylenex or hyaluronidase that can dissolve that filler. With Sculptra, do you ever worry that there's no like antidote if you were to get into, like a blood vessel and, have that type of issue come up?
I'm not overly concerned with the lack of antidote, A, because the result is built over time. B, I use a hyperdilute solution. So I use in total 9 cc of fluid, and that allows for very even distribution. B, I prefer to use a cannula, so the chance of getting into the blood vessel is a lot smaller. And even in the unlikely scenario, if I was to hit the blood vessel, because the solution is so dilute, likely the effect is going to be very minimal.
With HA filler and just filler in general, people are worried about this like pillow face, type of appearance. And there are studies now that show that filler migrates quite a bit, and we have videos on that subject. So do you see the same type of impact if Sculptra is overdone or not done properly, or does it behave differently?
The short answer is no. A, Sculptra doesn't migrate, it stays where we placed it. And B, the hyaluronic acid fillers are hydrophilic, meaning that they drive water from the tissues and expand in size over time. Sculptra only stimulates your body's own collagen, and that process is a lot more slower and gradual. So if done correctly and in the right hands, it produces a very natural result. So the pillow face is something that's a lot less commonly seen in Sculptra. So just to recap, Sculptra is a bioactive collagen stimulator that helps rebuild definition to the tissues over time. We can start using it as early as 25 years old or at any age where patients could see some volume loss in their face. And on average, people need about 3 to 4 treatments, and the result is sustained for about 2 years.
And I've seen some of your results, and I think they speak for themselves. Very impressive.
Thank you.
Is Sculptra a good way to delay the need for a facelift? Because a lot of, specifically women, are looking to not get a facelift anytime soon, and maybe they can delay it forever potentially. But is Sculptra one of those treatments that you'd recommend for someone who's looking to keep the tissues from dropping?
Definitely, because when the tissues are building collagen, the skin remains tighter, so there's definitely less drooping, and it maintains an improvement in skin texture as well, which, as we know, oftentimes the facelifts are done in combination with lasers and skin resurfacing and things like that, so Sculptra is helpful for the skin texture as well.
And of course, we know for skin texture and just overall skin quality, Feel Confident products is where it's at, so make sure to check those out. In addition to subscribing to this channel, please make sure to follow us both on Instagram. Our IG handles are in the description below. And let us know what other videos you'd like us to make together, specifically about non-surgical aesthetic treatments.